Corey!
Is it better for him to be in the bed, or do you want me to get him in the chair?
Whatever you think is best.
I don't know.
I think he's good in the bed right now. Look at him with his maraca. Hey, buddy. How are you? Are you excited for today? Are you excited? So Gilchrist Kids ranges anywhere from newborn all the way to like young adult is kind of, I'd say, like 26, 27. The reason that I got into nursing was because it started when my grandfather was in the hospital. He had a heart surgery, and I just remember I was a child at the time. I had like an admiration for the nurses. He had a long 3-month extended stay, so you really got to know them and get to, kind of become like family. Pediatric hospice is pretty different from adult hospice, to where our children can still get treatment, and it's called concurrent care. So our children are with us for typically a lot longer than with adult hospice. I come to the home once a week at least. We talk multiple times a week, and you just can't help but become, form a relationship and just, care about them as people, care about your patient as like the person and not the patient. Because at the end of the day, we're human, and I think that relationship is necessary to do this work. They want people to care. They want people to care for their child, to, feel what they're feeling, to, feel when they're sad. We also, are grieving with them. You can't help but when you see someone so often, and we all have like this same goal in mind, is to keep this child home and comfortable, that you just can't help but, form relationships that sometimes last well long after a child has passed away. Right when I walk in, of course, I greet the family, I greet my patient, I scope and do like an initial safety assessment. I do a head-to-toe assessment.
Give me a thumbs up. Good job, Corey. Can you give me a peace sign? Well, good job, Corey. Can you give me
I check their skin for any breakdown. We do typical vital signs, a lung assessment. All of those really important things that would raise concerns. I then go through and check all of the medications that are supplied by our team. I take care of all of the refills and the delivery, medications that are prescribed by other physicians and specialists. And it's just one less thing that they have to think about. Our team really prides ourselves on allowing parents to care for their child. We're not going to be at the bedside, 24/7, but we do give them all of the tools needed to care for their child. They're never alone through this experience, and that's what I, kind of tell my family is like, you are going through a really terrible time, but we can promise you that you're not going to be in this alone. We can't promise you that there's going to be a cure, but we can promise you that you won't be in this alone, and that whatever you need, we'll make sure that you're supported, and we can guide you through this, because this is what we do. Unfortunately, there's always going to be a need for it, and some children do wish to stay in the hospital. The majority of our patients want to come home, so we just make sure that we're able to give the family that opportunity if that's what they wish.
I had no idea that I would have a child that would be in hospice. To have the option of doing hospice at home in the most comfortable environment, where where your belongings are, your children or your loved ones feel the most comfortable. Home is home. To have a team come into your home and provide this care, it is awesome. It is absolutely awesome. I know it probably sounds corny, but it's incredible. And I'm so glad that it is offered to me and to other families. The team, the expertise, the skill, the service, it is wonderful.
One time I was talking to our chaplain, and I was like, I don't know how much longer I'm going to be able to do this. And he was like, if not you, then who? And I was like, that is a really good answer, because once you help a family through a really difficult time and then you get that new admission, it's like kind of like, okay, on to the next family to help, through this really difficult time.